Good afternoon, everyone. Thank you so much for joining this month's Teach Educational Rounds. Here with us today, we have Stephanie Kersta and Carolyn who will be presenting on brief solution-focused strategies for cessation. We'll just get started with our land acknowledgement. CAMH is situated on lands that have been occupied by First Nations for millennia. Lands rich in civilizations with knowledge of medicine, architecture, technology, and extensive trade routes throughout the Americas. In 1860, the site of CAMH appeared in the Colonial Records Office of the British Crown as the council grounds of the Mississaugas of the New Credit, as they were known at the time. Today, Toronto is covered by the Toronto Purchase Treaty No. 13 of 1805 with the Mississaugas of the Credit. Toronto is now home to a vast diversity of First Nations, Inuit, and Métis who enrich this city. CAMH is committed to reconciliation. We will honor the land through programs and places that reflect and respect its heritage. We will embrace the healing traditions of the ancestors and weave them into our caring practices. We will create new relationships and partnerships with First Nations, Inuit, and Métis, and share the land and protect it for future generations. So I now encourage everyone to introduce yourself in the chat and let us know which traditional territory you're joining us from today. If you're not sure, you can use the website we've put there, so www.whos.land to find out. And you're also welcome to let us know something that you're doing to learn or improve your commitment to reconciliation. So we'll give you a few moments to do that and share in the chat. Welcome, Jason and Adrian. Wonderful, Brenda. Denise is from Renfrew County. Wonderful. Welcome, everyone. Treaty 6 territory, Northern Saskatchewan, home of the Northern Cree and Métis Nations. Wonderful. Thank you, everyone, for sharing. We'll give you a couple more moments. Thank you, Marilyn. Welcome. That's awesome. All right, so we'll keep going for now, but please feel free to keep sharing in the chat. If you're interested in receiving a letter of completion for this Teach Educational Rounds, please make sure you have registered for the webinar and completed the pre-learning assessment. As well, make sure you've signed into the webinar using your full first name and last name so we can track your participation. And lastly, make sure to complete the evaluation and post-learning assessment that will be emailed to you by tomorrow. And know that we'll also be sending along with that the webinar recording and the presentation slides. So here's a little bit more information on our presenters today. Stephanie and Carolyn are master's level mental health clinicians, educators at a number of post-secondary institutions, and the co-founders of Home, North America's largest modern meditation studio. Carolyn and Stephanie co-created the Mindfulness in Modern Society certificate program at McMaster University. So welcome. And Carolyn and Stephanie do not have anything to disclose. Please note that the content of Teach is primarily based on evidence-based guidelines from the following sources. Nonetheless, these materials, as well as the verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. So please feel free to use the chat feature throughout the webinar to post any comments or answer any prompts from the presenters. To do this, you can click on the speech bubble icon in the control panel, and please ensure you select everyone so that all panelists, hosts, and attendees can read and respond to your comments. And you're also welcome to use the reaction feature if you would like to send a smiley or clapping hands or thumbs up at any point. You're welcome to do so. So with that, I will hand it off to our presenters to take it away. Thank you, everyone, and enjoy the webinar.
Great, thank you so much. And thank you all for being here. Steph and I are really looking forward to having this conversation today. Actually, solution-focused therapy is probably my primary modality in terms of therapeutic framework from which I practice as a clinician, and same with Stephanie as well. And just to sort of add on a little bit more in terms of who Steph and I are, but we actually met probably about 12 years ago now, working at a group of methadone clinics. So Stephanie and I were both addiction clinicians at the start of our career, and that was actually where we first got introduced to a lot of nicotine dependence work. And both Stephanie and I are teach trained, and we started running a nicotine dependence group together many years ago. And actually now, like when we look at like solution focus and motivational interviewing and all these different frameworks, they work very, very well when it comes to smoking cessation, and particularly also any kinds of forms of working with clients who are struggling with addictions. What I love about solution-focused therapy is I think, solution-focused therapy, I mean, Steph and I now also run a private clinical practice together. We do quite a lot of things together. We'll talk about codependency in a different presentation. But running our clinical practice, when I talk about solution-focused therapy, most of our clients know their problems, right? That's why they come to therapy to begin with, is because they know and they understand generally what the problem is. They're coming to see a therapist for solutions and to work to solutions and to their problems, not to talk more about the problem. And I remember when I did my solution focused certification through U of T, and really focusing on, and it was really there that I had this aha kind of light bulb moment, that if we spend all this time with clients in clinical practice talking about the problem, what happens is that clients might leave feeling like we've just simply magnified their problem and focused in on it so much that they actually feel worse when they leave therapy than better. And so really the solution to that is solution-focused therapy. It's acknowledging that there is a problem, but it's really gearing and orienting the client towards how do we solve this? And I remember realizing that because, again, as clinicians, we're so problem centric, right? We go through, I mean, Stephanie and I both did our undergraduate degrees and our master's degrees, and psychology is so about like what's wrong with people that very often we neglect to focus on what's right or how do we solve things. And that's why I personally really love solution focused therapy, is that it really is about getting the person out of their problem, and feeling better, and also empowering that person to solve their own problems. And this quote here, which I always love starting off our presentations on solution focused therapy with, is, "We can't solve our problems with the same thinking we use to create them." And this is really kind of the crux of what solution focused therapy is all about. It's about being creative and finding solutions to our problems, and making some big change.
So just to briefly go over some of the definitions, and again, we'll just touch on them quickly. You'll oftentimes hear solution focus and brief therapy used together interchangeably sometimes. Really, brief therapy is kind of an umbrella term, so it refers to many different types of counseling. And brief is really just when we're looking at short-term sessions, so anywhere between 3 to 12 sessions, but then we're also starting to see a lot of evidence base for single session therapy sessions. And when we look at brief therapy and the advent of brief therapy, that's where solution focus really came into focus quite a bit, because we see that when we do have a very short period of time, either a single session or 3 to 12 sessions, we're oftentimes needing something that is very goal-oriented, very solution-focused, to be able to move clients through the stages of change. Then when we look at the solution-focused approach, and Kara also described it quite a bit, but really it explores what the client's already doing that's more kind of on track to where they'd like to be. And that's a stark contrast to that traditional problem-solving model that focuses on, a lot of that intake gathering, a lot of information about the problem, and then determining what the client needs to do to get better. We're already looking at, I always like to think of it as quite strength-based. We're looking at what the client's doing right and starting to do more of that.
Absolutely. I think, and to Marilyn's point here in the chat, and actually please feel free, like throughout the presentation today, post information in the chat, questions, ideas, anything that anything that you feel comfortable to share with us about your experience in solution-focused practice. We're going to keep an eye on that sort of as we move through the next 45 minutes together. But Marilyn wrote, insanity is doing the same thing over and over and expecting a different outcome. And you're right, that solution focus is what gives people and our clients a look at the problem from a different lens. And that's so important. And again, I think when we look at being clinicians, particularly in a very medicalized world, and the way that we tend to pathologize a lot of diagnoses and emotions and things like that, it's so important to sometimes remind ourselves to come out of that sort of diagnostician's lens and the problem focused lens into those solutions. And that would be sort of my encouragement to all of you now in your clinical practices, is to try to weave in some of the strategies that we're going to show you, weave those into your clinical practices. And there is really a strong evidence base for using solution-focused therapies when it comes to assisting and supporting those who are, looking at, to say, stopping, nicotine dependence. And so when we look at evidence for cessation, these are just a few of the studies that are out there. But one that found that brief solution-focused therapy for tobacco cessation positively impacts client sense of self-efficacy regarding cessation. And that's, again, as Steph mentioned, from a strengths-based approach, right? We know this, that it's so much better to help empower our clients that they can solve their own problems than it is for us to go on in and solve it for them. And that's really what solution focus is all about. It's helping empower them to realize, to come to solutions themselves. They also found that solution-focused therapy tends to have an advantage of reducing smoking in psychiatric patients over other forms of psychotherapy. So that's also something. And the nice thing with solution-focused therapy, as Steph mentioned, is that it can be done very quickly. And we all know that we are very pressed for time, particularly nowadays in post-pandemic. There's such a high demand on our clinical services. So knowing that we have these strategies that in one session or 3 sessions can have a significant impact is really great, right? Because not all clients are going to be able to come sit with us for 8 or 12 CBT focused sessions, but 1 to 3 solution focused sessions might have significant impact, or will have significant impact. And then also brief solution focused interventions can be impactful when helping move clients through stages of change. And we know that many of you who have taken CAMH webinars before, CAMH trainings before, you're familiar with the stages of change and, likely motivational interviewing, and how important it is to move clients from, a pre-contemplative or a contemplative stage of change. So just when they're starting to either, don't even know that there might be a problem, or they're just starting to recognize it, helping move that client into a place where they actually can take some action on it and start moving forward towards their goals.
What I love about solution focus too is, so I think it works so well with motivational interviewing. They work so well together. They complement each other so nice. But even above and beyond that, any type of psychotherapy or counseling that we provide, solution focused, like the skills, and you'll see it's very skills based. A lot of the questions that we ask, a lot of the techniques that we use, they also complement what we're already doing. And so I find that what's nice about it is that, you can be a strict solution focused practitioner and only do that, but many people aren't. And so it's nice to be able to pick up a skill here and there to be able to add into your client sessions.
One of the best ways to start solution-focused therapy and to orient yourself as the clinician to be providing this is to take the position of not knowing. So this is really, they're one of sort of the founders of solution-focused therapy is Insoo Kim Berg. And if you've ever watched any videos of her online, you'll see that she does this very, very well, and she embodies this position really well. It's that the not knowing position. It's just having this sense of curiosity of the client who's coming in. So they are the expert, not you. And you're taking this position of really wanting to know them and having them tell you about who they are. So she really uses often the word curious a lot. She'll say, I'm curious about this, or I'm curious if you could explain more about that, or I'm curious to know why you feel that way, or why that happened. And showing this curiosity, showing that I don't know, you are the expert of you. I want you to tell me. It's really, oh, that's awesome, Carolyn. I'm very jealous of that you got to have that experience with her. It must have been really amazing. But to know that and to be curious and interested in who the client is really again, you'll see it becomes the foundation for a lot of these techniques and strategies that we add on in solution-focused therapy. And so how do you do this? I mean, the first is absolutely is listening. And we all know it's not just listening, but it's really being an active listener. So listening to what the person is saying, but also the subtext of what the client is saying to us. Formulating questions, but we know in psychotherapy, questions aren't just questions. We want to ask questions that are thoughtful and purposeful, and that are designed to go deeper in with the client than just sort of superficial or surface level questions. We want to continue to, a very famous statement that you'll see in solution focus is tell me more, right? When a client gives you something, you ask for more. And then what happened? Or keep going, tell me more. What happened next? What happened next? These kinds of things help progress the conversation, but also force the client to dig deeper into themselves. And again, it's usually in that depth is where we start to figure out and find solutions. We want to echo their keywords, so certain phrases, statements, emotions that they say, we want to reflect those back. We want to, of course, normalize the experience that that person is going through. The one I love is silence, and this is a challenging one for many clinicians because we feel like we're supposed to, fill that silence, and silence can feel a little bit awkward or uncomfortable. But what's really amazing is if you sit in silence with your clients, we want them to fill the silence, not us. And usually I find generally when I sit back, especially after I've asked a question, and I sit back in the silence, the client generally fills it eventually with something usually pretty significant or quite profound. And so I would, again, just encourage you to try silence a little bit more. And they'll tell you if they don't have anything to say. Like I've had clients where we were sitting in silence and then they'll say, I don't know what to say, or, I'm not sure where to go from here. And then I might maybe re-ask the question or try phrasing it in a different way. Complimenting. So complimenting, and this is something that's a little bit different because we don't tend to do this in all forms of psychotherapy or treatment. But complimenting, what we really want to compliment is action or change that we notice from the client, right? So if they did something, Insee would often will say, if you watch her videos, she's like, wow, like she gets really kind of excited when she hears that a client makes some kind of change. And that helps the client feel good, right? It's positive reinforcement that then hopefully will encourage them to continue that. It's always keeping the focus on the client and exploring kind of the deeper meanings behind some of the ways that they're feeling and acting.
I always feel like it's such a nice, just a nice way of having a session as well. Like it's just such a positive, affirming session, and, being able to really amplify the client's sense of change and what they're doing and how they've overcome things. I think that it also just it builds that therapeutic rapport, but it also leaves the client feeling really good about themselves, and again builds into their strengths and their belief in themselves.
Absolutely.
So just looking at the 5 stages of solution-focused therapy, we'll go through each of them. So the first stage is describing the problem. And again, because this is more solution-focused and not problem-focused, this is, it takes up quite a bit of less time than other sessions or other styles where you would be spending, a significant amount of time exploring the problem. And there's specific questions that we ask when it comes to describing the problem or gaining the problem. Why the client sought out therapy, developing well-formed goals, exploring for exceptions, end of session feedback, and then evaluating client progress. So that first stage of describing the problem really involves exploring why the client came to see you. So a common misconception with solution focus is that clients are not allowed to talk about the past or the problem. But again, it is a misconception. We do need to know what we're treating, right? We do need to know why the client came to see you, but it's not the main focus. And it's really important to use, our requisite MI skills. So, using ORs, using change talk, really diving deep on just kind of really strong counseling skills, building therapeutic rapport, and starting to build trust with the client. Also looking at describing the problem, we know that clients have their own valid perceptions and experiences of the world that may be very different from our equally valid views. So we look at this as clients' frame of reference. And, this just looks at every single person that experiences something, we all experience it in our own way, our own frame of reference. And so it is important for us to know where the client's frame of reference is, and then also start to look if there's a different way that we can look at the same situation from a different frame of reference. So when we are describing the problem or ascertaining the problem from the client, what we want to ask is, how are you hoping I might be useful for you today? How is this a problem for you? And then, if there's more than one situation or, problem that the client wants to work with, ask what's most important. So have them scale the importance for it. And then also, and this is a big one, what have you tried so far? Starting to look and see what was helpful already. And we want to explore, was it helpful versus why didn't it work? Right? So we're already coming from that more solution focus. We're already starting from the very first session or the very first moment of treatment. We want to be looking at what are potential solutions? What are things that the client has tried already? How did it work in those different ways?
And that first question, how were you hoping I might be useful to you today, is probably how I start almost all of my client sessions now. And initially, when I very first learned it, it took the pressure off of me as the clinician to somehow be the reason or like find the solution to that person's problem. Like here they're coming to me and I'm like this magician who just knows exactly what this person needs. And so it's and I would encourage you all to try it and just, again, be curious with trying some of these different techniques and seeing how they fall. Because it's really amazing that sometimes when people come in to see me, especially clients that I know, and have a relationship with, what I would have started the session with or what I would have focused on is very different often than what they want to focus on. And so I love asking that. It just, again, it puts it right away, puts it onto the client to identify what it is that they need. And so I love really using that. And it's such a great solution focused question. And then we wanted to develop well-formed goals. And this is something I think that a lot of clinicians, like we know that we're supposed to help our clients identify goals, but I think a lot of us fall flat on how do we actually create goals for the client that they're actually are going to be or could achieve. Right? We all know probably SMART goals, right? Making things like specific and measurable and achievable and realistic and timely. And that's really very similar to what solution focused advocates for as well. It's very specific goals, right? And we want them to be small and concrete because we want quick wins for our client, because we know that the faster that they have a win, the more motivation they're going to have to continue onwards. So we want them to be important to the client, small and concrete, that it's the beginning of something rather than the end of something. So even if we're thinking about cessation, it's not necessarily the end of their smoking journey, but perhaps it's the beginning of their health or wellness journey. And so again, just that slight way of orienting things can be a lot more motivational and a little more kind of inspiring for the person than for them to feel like something is coming to an end or a closure. And we of course want it to be something that's within the client's control, that it's something that they can actually do. And again, when we're thinking that they must be important to the client. So again, what we think is important and what the client thinks is important can be two very different things. And so our thoughts are really irrelevant, but I will ask the client, why is this important to you? Right? And just have them make sure that, that they can identify why. Also using interactional terms, so the way in which other people might perceive themselves is greatly influenced by kind of the social context. So I'll feel better about myself. Like when you feel better about yourself, what difference will others notice about you? And that's something that's a very kind of core technique of solution focus, is to use relationships that people have as a way of helping that person identify how they could make change, right? So sometimes people get very stuck on, I don't know how to fix this problem. And I'll ask the clients, I'm like, okay, well, what if your friend was going through this problem? Or what if your partner was going through this problem? What might you suggest for that person? And it's so interesting that when we start to put it in the context of our relationships with others, that often we can come up with a lot of ideas and solutions or strategies. And then we want to try to see if we could apply that to the self. So I love this question, is that, what would your partner notice if you, stopped smoking, or if you were feeling healthier, or if you weren't using this substance as much? And then we start to identify those things, and then we start to flip those into specific goals for the person. Maybe they would notice that I would be going out, on walks with my children more, playing with them outside more. And that's like, okay, can we make that a goal? Can we somehow, shift that now into a specific goal for you? So again, it's putting that into interactional terms can be really helpful for the client. Again, we also want to look at environment and some of the situational features as well of a goal. So helping them narrow down what they might want to do within a certain place or a certain setting. And again, we want to look always for the presence of desirable behavior rather than the absence of the problem. So what are you adding to your life? What are you bringing into your life? What is the solution? Not just the removal of something negative or something that you don't like. Because if we just remove something, what you're stuck with now is this hole, right? Yes, we've taken away a behavior that you don't like, but now what, right? And so really solution focus is about filling that with something, right? What are we adding to our life that's going to have a positive change or potentially solve this issue or this problem? And again, we always want to look at things as a beginning step rather than the final result. So for many people, it is just not realistic to kind of reach, like maybe it's abstinence is the ultimate goal. And I could tell you working in methadone maintenance, that was the goal. Almost, I would probably put it into the high 90% of clients that I would see. The ultimate goal was abstinence. That's what they would always say when we would meet with them. But where they are at today and eventual abstinence over here might be many, many steps. And so it's always good to go back. What's step number one? Where do we start? And then slowly we'll hit that goal eventually. But that goal right now might be way too overwhelming to see abstinence over here. So again, and as the solution focus says here, clients often describe the finish line, not the steps required. And that's where I think where sometimes as clinicians we fail when it comes to creating these well-formed goals is we often in our clinical notes we put down the big finish line goal. We don't often put down the little step goals. And again, that's something I want you to encourage you to think of when you are creating goals for your clients is like, are we really breaking them down into those really smart specific goals? And just a couple of other things. Again, you want the client's recognition of a role for themselves, right? So many clients often feel that their problems have been brought on by the actions of others, or they give away their power in terms of being able to solve their own problem. So we really want to empower clients that this is within your control, right? That this is something you can do regardless of what's going on around you, that this is something that you can actually take on and do. Again, we want it to be concrete. So we want to be able to measure it. How will I know between now and next time I see you that we've worked towards this goal? We, of course, want to be realistic, and we do want it to be a bit of a challenge because if they do something that's not a challenge, it's not going to create that motivation and it's not going to kind of make that person feel accomplished of something. So it does have to be slightly challenging for the person so that they will really feel like they overcame something or that they achieved a particular goal.
And Brenda in the chat, I really like how you phrase this. So I don't like the expression baby steps for small steps because it does seem like endless to get to the goal, taking baby steps. So now I use dominoes as a metaphor, as one change leads to another and makes the next one easier. And I think that's just incredible. I really like that.
I might have to take that too.
Seriously. Tonight I'm using dominoes. So exploring for exceptions is the next step. And so this is a really big one. And we're actually going to talk about exception finding questions a little bit later on when it comes to, the actual concrete skills that we can use. So when looking at exploring for exceptions, it really is important for us to listen and ask about times when the problem is not happening or when it's less severe or influential. And those are what we call exceptions to the problem. We'll talk about this a little bit later, but there's two types of exceptions. So there's spontaneous exceptions and then there's deliberate exceptions. And we do different things depending on the exceptions, but we do spend a lot of time, focusing on how those exceptions came to be, or when they were less severe. So it doesn't have to be that maybe it was the biggest problem ever or it was completely gone, but even just starting to look at times where maybe it was a little bit less, maybe a craving was a little bit less, or you were better able to manage a craving. Maybe your trigger wasn't as triggering at that time. And so we're starting to look and open up space to start to see if that change is already happening. And then it says the client's miracle, and we're going to talk about the miracle question, how we explore for the miracle situation with our clients a little bit later. So the definition of an exception really is when the problem might have been expected to occur, but somehow did not, or occurred to a lesser degree than usual. And exceptions happen instead of the presenting problem. So really, we want to be able to identify the exception times and start to become more aware of our current and past successes in relation to the goals. And the way that I like to think about this is it's just a shift in our focus, because so often when we're problem focused, clients tend to see, we tend to look for that evidence base that backs up our thought process, that backs up the problem, right? So I'm dealing with anxiety, and we can think about and name all the times when our anxiety was a problem, but we don't usually look for and name all the times where our anxiety maybe was a little bit less of a problem. And so exceptions are really, I like to tell my clients, it's just a shift, or it's a different color lens that we're putting on if we're putting sunglasses on, we're putting pink ones instead of blue ones. Really, it's just a shift, and we're looking at something from a different perspective. We're looking for different things. And so when we explore for exceptions, really we want to use this kind of EARS acronym. So looking for ways to elicit change, we want to amplify that change, reinforce or complement, and then start again.
And so then when we look at end of session feedback, it's really interesting. I think in a lot of forms of therapy, we never ask for feedback as the clinicians. And I wonder why we don't actually now when you think about it, because solution focus is very much about gaining feedback. How are things going? How are we doing? How is our sessions going? How are you finding things? Because really with solution focus, it's about not wasting anyone's time, right? It's about wanting to make sure that we're constantly refining and shifting things so that if it's not helpful, we're going to make it more helpful. And that's why I think it's really great. I mean, at the end of a solution focused conversation or session, we usually use the last 15 minutes to get feedback, how they think the session went, what we want to focus on, what they need more of or less than from me as the clinician. And this is where also I have an opportunity as a clinician to provide a lot of compliments, to really summarize what it was that they shared with me and highlight and motivate that person by reflecting on some of the actions that they've taken, recognizing some of their successes, or recognizing their strengths. Right? I think that, sometimes we feel challenged if the client hasn't made any progress or done any actions. We struggle with how do I compliment the person when they haven't really done anything? And so for me, I always will highlight the fact that they keep showing up, right? The fact that they came and sat with you and spent 45 minutes talking to you about this particular thing, that's always a strength that you're always able to rely on and to go back to. And that's something, again, that if you're just really questioning, like, I don't know what to highlight that, right? Highlight that this was, I know that this took a lot to come today, or, you should be really proud of yourself for sitting down with me for 45 minutes and talking about something that's really difficult or something that's challenging for you. And the fact that you keep showing up here, and even though, maybe you haven't yet made the change that you want to make, but you keep showing up, that's something to be really proud of. That's an action that you're showing up today. So that's always something that I do grab onto, especially if I'm really not sure what else to highlight or to compliment on. And then again, just pulling out anything that they've shared with you throughout the session. We also want to offer suggestions, and this is the nice part about solution focus, is it gives us a chance. It's not advice giving, but it's suggesting. It's like, could I put forth a suggestion? And I always ask the client that way, so we ask permission first. But between now and the next time I see you, do you think, maybe cutting down from, a pack of cigarettes a day to 20 per day might be something that you would be willing to try? And again, just seeing if the person is open to trying that, suggesting that, and then seeing where that lands. And maybe it's not going down from 25 to 20. Maybe they say, I'm going to try to cut out that morning cigarette, or I'm going to try to cut out that end of day cigarette. But talking about suggestions, and then always at the end of solution focused therapy is that we always will assign homework. So there always has to be something that the person is working on between sessions. And again, that's something that I think not all forms of psychotherapy do. We often don't. We sort of talk a little bit about it, but in solution-focused therapy, it's much more formal, the assignment of homework. And it's a very clear goal that the person is going to work on So then we get to talk about that next time, and we get to really highlight and motivate and challenge and, magnify if they were able to do it, or if not, what kinds of problems or issues they ran into, and how we can adjust and adapt it for the next time. So that's really, again, make sure that you kind of give at least like a decent chunk of time. I'd say about a quarter of your session should be able to be spent for that, towards the end.
And then lastly, evaluating client progress. So, we're assuming that positive change has occurred since the initial meeting, and, we explore and examine how the problem has improved or is less influential. And again, using those ears skills to elicit the change, amplify it, reinforce and complement, and then start it all over again.
So this is probably my favorite part of our talk today. And it's the tangibles, right? I mean, this is often why we attend talks like this, is like, what's the takeaway and how do I actually use this in clinical practice? And so we've kind of pulled our kind of top favorite solution focused techniques for you all. And we'll go through on like how we might actually be able to use these in practice. And again, I hope that, and I encourage you all to try, being curious about putting one or two of these into your next sessions, and again, seeing how they resonate or how they land. But the first and probably most famous technique that comes out of solution-focused therapy is the miracle question, or also known as like the problem gone question. And it is a method of questioning that, whether it's coaches or therapists or clinicians can utilize to help the client envision and to describe in detail the future or how their future would be different if the problem no longer existed. And if you watch, and you can certainly go on YouTube and Google like Insoo Kim Berg miracle question, or if you watch solution focused clinicians do this miracle question, it can take up a full session. You can spend a full hour with a client going through this question, especially if you have a client who really connects with the question. I would encourage you to keep expanding it and really kind of play with it. And a lot of clinicians can get very playful with the miracle question. So the miracle question at its core is really asking the person that if this problem were gone, so let's say you go to bed tonight, you wake up tomorrow morning, problem gone. You open your eyes. How do you know that the problem is gone? What's the first thing that would indicate to you that the problem is gone? And so you have the client walk through their day. So for instance, if the problem was smoking and they wake up, what's the first thing you would notice? I wouldn't be craving a smoke. First thing I would notice is I wouldn't have that craving. I would notice that I don't have to bundle myself up and go outside, just have a cigarette in the, cold of the winter. I'd be able to just get up and go enjoy my breakfast with my family. Maybe I would notice that as I got out of bed, I wouldn't be winded. I wouldn't be out of breath as I was walking down the stairs. Right? And you would go through the whole day and you would really focus in on every element. Well, who would you encounter first? What would they notice? Then what would you do? You go to work. What would be different? Well, maybe I wouldn't be going out for cigarette breaks all the time. I wouldn't have to be always, putting breath spray or eating gum or going to wash my hands. I wouldn't have to be worried that my partner would smell smoke on my, mouth when I came home or when I kissed them goodbye or hello. And again, so you would go through their entire day and you'd highlight to them, how would you feel? How would that make you feel? What emotion would you feeling? How would that be better for you? And again, the idea is you want this person to really create a very, very clear picture of what life looks like without this problem. And then the way that we would end that session is we would try to zone in on one little part of that day and see if they could live one part of that miracle, right? So maybe it was, that again, that morning cigarette, or they wouldn't go out for the, cigarettes throughout the break at, every hour at work. Right. So it's like, maybe let's see if we can remove one of those. And instead of going out for that cigarette at work, maybe you do just go chat with your coworkers and you don't miss out on that because you don't have to be outside smoking, and so you get them to really zone in on living one part of that miracle. And then hopefully over time, we start expanding and expanding and adding and adding and adding. And eventually they are living their miracle day.
I also really like the what's better question. It's often a really frequently used focus one, and we often use it in a follow-up question. And so generally when we see a client, we ask kind of how it's been since the last session. And, in more traditional style, we tend to focus on what's been challenging since the last time we saw that person. This flips flips the script and we're looking at what's been better. So what's been better since the last time I saw you? How was your week? What's better since the last time we met? And it's oftentimes quite jarring if we're not used to it, because it is a little bit where it's what we're not used to, right? But the advantage is that it really helps us to focus on the progress that has been made and what's worked well. And it has a motivating effect because it leads to more awareness of what works and going forward. So I can, generally the first time you ask that question, client's going to be maybe a little bit flustered, not going to know what to say. But knowing that that's how you start the session, you know that your client is going to start looking for what's been better, what's been focused, what's been better since the last session, changes that have been made. And so it helps with that shifting of the way that we look at things.
I love that, because I do have a few clients now that they bring me what's good. They bring me, that's what they bring into the sessions, and they're excited to bring into the sessions the positives, right? Because I think so many people, when you think of therapy, we think of bringing in the negative. We think of bringing in the challenges or the problems. So I love asking that. Again, I would just play with it. Ask your clients that the next time you see them, what's been better since the last time, or what's been good in your life since the last time we spoke, and just see how it resonates with them.
And it's nice to be able to talk about it, right?
Yeah, it is. And it does feel happy, right? When you start to be able to magnify and again, as you said, motivational. It's a lot, the therapy sessions are a lot different when you're having it, what's better and what's good.
Absolutely. And then Brenda, just question about the miracle question. That's interesting that sometimes clients will think that it's more kind of like magic or miracle focused, and not that they need to do the work, or that it feels almost insurmountable. I would just shift a little bit to changing to problem is gone. Like the problem is gone, and just don't use the language around miracle. And I find that tends to be a good shift as well. Something else I find with the miracle question, I like to ask it as homework when I first meet with someone. So at the end of kind of my intake session, I'll generally start the session, or leave the session as a bit of a homework. So I set up the miracle, then I ask them to to go through their week and think about what would be different, what would be present in their life, jot down notes for me. And then the next session, when we lead to goal setting, we're able to really dive deep into kind of each day of the week and what's different. So I find that works really well as well.
And scaling questions, which I saw a little bit here in the chat. So scaling questions, solution focus certainly uses scaling questions. I don't know if they're necessarily unique to solution focused therapy. A lot of different forms of therapy use these kind of Likert scales or encourage people to use scaling. But it is a very well-known technique and very frequently used technique. And so you can put anything on a scale. Generally, we use scale of 1 to 10. You can use a 1 to 5. You can use a 1 to 100 scale. But it's just asking the person to scale. Usually it's emotions. And it helps you to identify where that client is at, and then how we might move that client further along in that scale. So oftentimes we want to highlight, oh, sorry, our fire alarm is going off here, but sorry about that.
I don't even hear it.
Hear it, okay. So not only do we want to highlight, we want to highlight where the client is at, but we want to highlight why they would put themselves at a certain number and not lower, and then how we would get them to go up just a little bit more. So I might say if a client puts themselves at 7 out of 10, let's say maybe it's on confidence, right? Ability to make the change. Why would you place yourself at a 7 and not like a 4 or not a 5? So I want to highlight there, because there's this, whatever it is that made them not put a 4 and put a 7 instead, that's a strength. That's the stuff I want to highlight. I want to reinforce. I want to motivate that person to continue to utilize whatever that was that helped them build that confidence. And then I want to say, what do you think it would take to move up from a 7 to a 7.5 or a 7.25? What would be different? What would you need to add? And so it's a really great way of helping that client, especially visually too. And a lot of people will use visual. I know CAMH often we have the readiness ruler, and we have some good visual guides on how you could move that person up on that scale. But it's a good one that even to just pull out a piece of paper and just write 1 to 10 and have the client plot out where they are. And it's a good reminder too, over time, it's when you first started, you put yourself at a 4 out of 10 for confidence. And now here we are a few sessions later and you're an 8 out of 10. And so it's a good reminder that they have made some change and some progress there.
Going back to the exception finding questions that I mentioned before, so pretty straightforward, but looking at, are there times when this problem does not happen or it's less serious? When, how does it happen, are really good follow-up questions. And then also tell me about a time when this problem was not so bad, what was different about those times, and then really digging deep into those. Talking about deliberate exceptions, I call them spontaneous, but I put random here. So deliberate exceptions are oftentimes when a client has made a change in their behavior and then we have an exception. So they have changed something and that we now experience that exception. So with that, again, lots of complimenting, lots of praise, but encourage clients to do more of the same in order to make the exception time happen again. Great way to really kind of build in that locus of control as well. Random exceptions happen when the client indicates that the exception was not caused by something in the behavior. So oftentimes they can't identify what caused this. This is an observational homework kind of focus that we do. So we encourage clients to pay attention to similar exception times in the future and how they happen. So I work with lots of teens and young adults. So oftentimes I'll use like, this is where we're doing like, we're putting our detective hat on and we start to really dig deep into, now I want you to start to try and figure out what's causing this exception as well. So a little bit different in terms of how we look for exceptions, and then really lots of following up with that.
And so generally when it comes to exceptions, I mean, for the most part, there is exceptions generally, right? I mean, we're not, again, I'm generalizing here, but we're not depressed 24/7, right? Or we're not anxious 24/7. There usually is small amounts of time where we do feel better or where that negative feeling is gone or that problem or that issue is gone. But there might be clients where sometimes you ask them to search for exceptions and they tell you there's none. There's no exceptions. I feel this all the time. The problem is always there. Things are never getting better. In those cases, oftentimes that's where we as clinicians start to feel a bit stuck, right? There's no exceptions to this. We don't know what to do. Solution Focus has a solution for that, and that's the coping question. Instead of focusing on like searching for the exceptions or moving the client through other techniques, go to coping, right? That's a great way. The client somehow, here they are dealing with this problem 24/7. There's no exception to this problem. And yet they're getting through the day, or they are somehow coping through that day, or they're still coming to see you. So really in solution focused therapy, we want to illustrate to the client that despite all the challenges, despite this like ever present problem, you still have strengths. You're still using some kind of skills and abilities to cope through. And that's really cool, right? To be able to identify that for that client and to help magnify for that client that despite it all, you are still able to demonstrate some strengths. And so you might ask the client, like, how did you do that? How have you managed to only smoke 1 pack a day despite all of these triggers? How did you manage to get out of bed today? How did you manage to come to the session today? How did you manage to talk to me about this for the last 45 minutes? All right, and that helps the client again, but that idea of building self-efficacy, building that, highlighting on those strengths, showing the client that you are getting through. You have strengths and abilities because this is challenging and yet you are still moving through it. And again, you should be really proud of yourself for moving through it and for coping through it. So it's not that you're necessarily solving the problem, but you're coping through it. And that's a positive, and that's already part of a solution. So I really love that. And I find that whenever I feel stuck as a clinician, I often will shift into coping with the person, like just how are you doing that? How are you managing? And it's usually through there that the person starts to realize like, wait, I do have skills and abilities and strengths, and maybe we can stretch and apply those to other things and help move them a bit more forward. So go to coping when you feel stuck with where to go.
And then another one that we really love, and especially when we're a bit stuck as well, is the relationship question. And they're really helpful when the client's struggling to find solutions or strategies for themselves. And it just provides a different way of looking at the situation. Because I find sometimes when we're so caught up in our own problem and our own day-to-day, it's really hard to come up with solutions. It's really hard to come up with ideas. So I'll have clients who are stuck with, some of the exception finding questions or, even coping questions, sometimes there's a bit of a challenge. And so I really like to pull out the relationship question when a client is stuck. And so oftentimes, at its core, it's like, what would you tell someone else if they were struggling with the same issue? But you can really kind of build it up. So oftentimes I'll like describe the issue. I'll say like, who's your friend? Like name a friend or name a partner, and then say like, let's say they're coming to you and they're saying blah, 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 all the issues that they're dealing with. Like, what kind of advice would you give them? And so oftentimes it's easy for them to kind of like, nail out or kind of name off lots of different things that they could try. And then I'll say like, do you think that any of those things you could try? Do you think any of those would work for you as well? And then we explore that and choose one that maybe we can work on. And then also when trying to come up with exceptions and some changes, or try to see what's better as well, oftentimes clients may struggle with that as well. So again, using those social interactions. So like, what would the people around you say about your behavior change? Or would anyone notice, or has anyone told you that they've noticed anything different about you since the last time we met, or with your behavior? So always when we tend to get stuck with our individual, I find pull out a relationship question, they tend to work really well.
And just some book recommendations here. I would say hands down my absolute favorite, and the book that I own and use quite regularly, is the last one here, 1001 Solution Focused Questions. It literally is just that. That's the entire book. It's actually 1001 Solution Focused questions. Yeah. Divided into different categories. And when I very first started using solution focus and integrating that into my clinical practice, I would choose randomly, like, okay, these are the 10 questions that I'm going to integrate this week into the way I work and speak with my clients. And that helped me really create and have a pretty good now toolkit of a lot of solution focused therapy questions that I ask all the time, that probably now I don't even realize are solution focused now, but it's just the way that the framework that I practice from now. So that one, get it. It's small. It's like a good little pocket-sized guide, but it is just very concise and succinct, and has been one of my favorite books, I think, by far to have. Any questions? We wanted to leave a little bit of opportunity for dialogue, questions, comments, anything in the chat. We're happy to take a few minutes to answer those.
Yeah, we still have a couple minutes, so if anyone has a question, feel free to ask them. Oh, Brenda has a comment.
Mm-hmm. Yeah, that's interesting, Brenda. I mean, I guess the question would be, we could certainly choose the behavior in which we want to commend, right? And actions that we do want to commend. It doesn't necessarily have to be ones, especially ones where it sounds like there's a bit of dependency here, right? So maybe, it's commending the time in between sessions, right? Maybe we'd be focusing on how did you get through, the weekend, when you weren't seeing people. That would be probably what I would want to try to highlight for that person. It's the time where they're not leaning on their other more kind of medical or clinical supports. Might be a conversation or something to highlight. And then absolutely, if there are other strengths that you see from that person, that might be a better way to orient the end of the session, is to provide some compliments around the other types of behavior, more independent types of behavior, versus the ability of like coming to the session or making their appointments and those kinds of things. Steph, if you have anything to add to that.
No, and that's great. It's, choosing what you want to amplify and choose kind of what's come up with that. So I think that's fantastic.
Wonderful. All right. Well, if there's no more questions, thank you both so much for such an engaging, interesting webinar with so much practical information. I know I learned a lot, and I can tell from the chat everyone else did as well. So just before we head out, I just want to remind everyone that I will be distributing a link to the webinar recording, as well as the presentation slides to everyone by tomorrow. And you'll have to complete the post-learning assessment by next week if you would like the letter of completion. I also just want to take the time to let everyone know about our next upcoming webinar. That's another very exciting topic where we'll be introducing our vaping cessation guidance resource that we've developed at the Nicotine Dependence Service here. And the registration link is already ready to go if you would like to register now. And if you missed a portion of today's webinar or want to view it again or view another Teach webinar, you can find an archive list on our website. And for now, thank you everyone for participating and listening. And thank you both so much, Stephanie and Carolyn, for such a great webinar. And hope everyone has a great rest of your day.
Awesome. Thank you all.
Thank you so
Thank
much.
you.
Enjoy the rest of your day.
Thanks, you too.